Have you ever wondered how anesthesiologists measure the efficiency of your breathing during surgery? How do they know if your lungs are working optimally? Let's dive into the science behind it, the Bohr Equation. The Bohr Equation is a key tool that helps doctors assess how well the lungs are functioning and how much of each breath is actually used for gas exchange. In today's video, we'll break it down and explain how this simple equation can save lives. The Bohr equation is a formula we use to determine how much of the air we breathe in actually takes part in gas exchange and how much of it is wasted. It looks a little like this, but don't worry, it's simpler than it seems. Let's break it down one piece at a time. First up, we have VD, or dead space volume. What exactly is dead space? Picture this, you're sipping a drink through a straw, but there's a bit of air left in the straw before you take a sip. That air? It's not helping quench your thirst. Similarly, VD is the air that enters the respiratory system but never gets to the alveoli to do any real work in gas exchange. This air just stays in the tubes, like the trachea and bronchi, and doesn't participate in oxygen or CO2 exchange. It's like wasted potential. Next, we've got VT, the tidal volume. Think of tidal volume as the total breath you take every inhale and exhale. It's like filling up a balloon. Some of the air is just sitting in the neck of the balloon, but the rest actually gets into the main part. In your body, the useful air in the alveoli is what's actually working to keep you oxygenated and remove CO2. So in essence, VT is the total amount of air you breathe in, and we're always trying to maximize how much of that gets to where it's needed. Let's talk about PaCO2, which stands for the arterial partial pressure of carbon dioxide. In everyday terms, this is how much CO2 is dissolved in the blood. We care about this number because CO2 is a waste product, and if it builds up, it means the lungs aren't getting rid of it effectively. It's like a trash chute in a building. If trash, CO2, starts piling up, you know something's wrong with the system. So PaCO2 tells us how well the lungs are clearing that trash. Now onto PeCO2, which is the partial pressure of CO2 in expired air. This number shows us how much CO2 is actually leaving the lungs when you breathe out. It's like checking what's coming out of the trash chute. If there's less CO2 coming out than expected, we know some of it is staying behind, trapped in the system. So how do all these puzzle pieces fit together? The Bohr equation helps us calculate the VD/VT ratio, or the ratio of dead space air to total air in each breath. A normal ratio is about 0.3 in healthy people, meaning 30% of each breath is dead space, and the rest is participating in gas exchange. But in patients with respiratory issues, like those with COPD, or acute respiratory distress syndrome, ARDS, this ratio can increase, meaning less of each breath is used efficiently. An anesthesiologist keeps an eye on this ratio during surgery to ensure that the patient is ventilating effectively. Finally, we explore the Bohr equation and its clinical significance in ventilation management. 1. The Bohr equation acts as an efficiency test for ventilation, indicated by the VD/VT ratio, which shows how effectively the lungs utilize air. A higher ratio signals reduced lung efficiency, prompting necessary adjustments to the ventilator to enhance patient breathing. 2. In the operating room, monitoring the lungs is crucial for maintaining balance, and the Bohr equation provides insight into their function. A shift in the VD/VT ratio acts as a warning signal, allowing us to quickly address ventilation issues and enhance patient safety during anesthesia. 3. A ventilation perfusion mismatch occurs when some parts of the lungs receive air without adequate blood flow, leading to serious issues like pulmonary embolism or ARDS. The Bohr equation helps identify this problem by monitoring the VD/VT ratio, acting as a traffic control system for the lungs. 4. The Bohr equation helps us identify ventilation issues, allowing us to customize ventilation strategies for patients with severe lung conditions like ARDS. By using this data, we can reduce dead space and enhance effective gas exchange, ensuring that every breath counts for our patients. Next time you're in the operation theater, remember, the Bohr equation is like your personal assistant, keeping an eye on how well your patient's lungs are performing. Thanks for listening to Optimal Anesthesia Insights. Subscribe and visit optimalanesthesia.com for more insights and the latest evidence on ventilation management.